AAMG. Your choice, your health, our mission.
I am Dr. Alex Leung. I am a clinical psychologist, and I feel very honored today to be able to share my professional experience in mental health, especially under this COVID-19 pandemic, how to deal with this issue and what is the psychological impact. At this point, it's obviously we all are under a lot of stress because of this pandemic, because we are all asked to stay at home and maintain the social distance of 6 feet, even when we go out, or when we go, we have to wear a mask. There's a lot of constrictions in terms of our daily activities. And we feel very cooped up at home because most of our outdoor activities are either shut down or very limited. So all we have the opportunity is to stay at home and facing the four walls. All we have been hearing most of the time are very negative news. How many confirmed cases, how many hospitalization, or even more distressing is how many deaths every day in the news. So that would easily make almost all of us feeling very isolated, very nervous, very anxious, and to the point of even feeling depressed. So in looking at the recent study on what is the frequency or number of depression under this COVID-19 pandemic, according to the number that was available in April, it showed that 49% of the population in the United States are showing signs of depression. And this was taken in April, which was 3 months ago. So it's very likely that the number actually is more than what was shown at 49%. It probably will be higher. And even with this 49% compared to what happened in 2006, it showed that only 37% of the population show signs of depression. So that's the quite insignificant increase in the number of depression cases due to the COVID-19. And fear of contracting this disease, it showed that 3 out of 5 people in the United States remain scared of contracting the COVID-19 virus. Again, the number is very likely to be higher because this was taken in April. With the recent increase in cases, it's very likely that more people are showing more fear about contracting this particular COVID-19 viruses. Okay, so if we are under such a strong concern or distress, how would that impact our psychological mind or our mental state? So there are some warning signs that will alert us that we are under stress by this virus. For example, suddenly we feel there are more discomfort in terms of numbness or all sort of somatic pains here and there, some kind of unfounded fear concerning going outside or catching germs, or some GI discomfort, stomach ache, stomach upset, or your emotional stage of temperament became much shorter these days. Usually you are quite an even-tempered person, but nowadays you get upset about things very easily. It's almost like you become a very short-fused person. Things that usually don't upset you become easily, would make you feel very agitated, throw a temper, or even pounding at your desk, or sometimes, or even yelling and screaming at your family members. And another sign is that you have difficulty in concentrating in doing things, especially in doing tasks that required your focusing, like doing mathematics or planning things, putting things together, and you feel like your mind kept wandering, you cannot focus. If you used to drink a little bit of a glass of wine, or even half a glass of hard liquor now and then, you have increased your drinking. Or if you're a smoker, you tend to smoke even more, even up to a pack or more a day. Or there are some medication you used to take to keep calm, or you used to take some sort of over-the-counter relaxation agent, or even sleeping pills, and you feel there's a need to increase the dosage. You have problem falling asleep, or you are frequently having nightmares. Those are very obvious signs that your stress level is increasing and is affecting your daily functioning. You used to be able to do daily exercise, or to go out for a walk, or even jogging around. You feel that nowadays you have very limited energy to do things, or you just don't want to. Your eating habit, you like to eat whatever kind of food before, you have a pretty good appetite, you can consume at least a bowl of rice with your meal, and nowadays not even half the bowl. Normally you eat 3 meals a day, and now you only eat 1 meal, and that's it. You don't feel like eating at all. And for a lot of the elderly people who tend to have different kind of chronic disease, such as diabetes, hypertension, or high cholesterol, those are very common disease that once you reach a certain age, and you feel there is a worsening of your condition. Your blood pressure seemingly have gotten much higher, or the sugar level that you measure every day and also on the rise. So these are very common warning signs. So once you notice those signs, and then you realize that you're under stress, the question you will want to ask is how to deal with it, how to cope with the stress. Well, one of the easiest way is actually to increase your opportunity to do exercise. It doesn't have to be very rigorous. It can be in a very relaxed manner, such as doing Tai Chi, or just a slow walk around the block, because any kind of exercise will increase your dopamine level. Dopamine is what we call feel-good hormones. And if you increase the dopamine level in your body, it actually will improve your mood, make you feel a bit more animated, will not be as lethargic or even anxious. And a good eating habit is very important. You make sure that whatever you consume for your meals is a well-balanced, nutritious meal. This, of course, you can learn a lot from the website of the AAMG, where they have a lot of information on what is a nutritious diet, a well-balanced diet. And sleeping is also important. It's important if you can keep at least 7 to 8 hours sleep every night. Even if you wake up in the middle of the night, try your best to go back to sleep. So the important is to make sure you have important sleep at night. And another thing is it's much better if you don't take a nap in the daytime, because if you take a nap in the daytime, actually you will have more problem falling asleep at night. Another thing is how to maintain connecting with others. At this time, because of the social distancing, a lot of us are feeling very isolated. We are most likely on our own or just staying with our family. And our usual social gathering has been very limited or even restricted. So if we can maintain regular contact with others, it would definitely help. But while maintaining connection with others, make sure you don't take in all the negative information and make sure you don't spread the bad news around, because there are a lot of negative information, which actually a lot of them are not true. So make sure you don't spread the rumors around and to make people feel even more miserable. And taking deep breath is very important, because once you feel anxious, you feel that your heart is beating much faster than you normally. Taking deep breath will slow down your breath, your heartbeat, and that would keep you calm and also maintain a positive thinking. Don't just focus on the negative and say, oh, all these bad news. I think this is not going to change. Oh, it's almost like the end of the world. That's not going to help you. Focus on the positive whenever you can. And also make sure at this time of the season of the year, actually there are a lot of sunshine because it's summertime. So if you can go outside and get some sunshine, it would have very good benefits, because the sunshine can give you vitamin D, and that would make sure your body function much better, and it's a healthy way. But make sure when you go out, you keep yourself covered so that you won't get that sunburn. Okay, so once you know how to cope with stress, it's important to know how to help others to cope with the stress as well. Nowadays, with the high-tech advancements, a lot of the seniors, elderlies are quite good in using all sort of high-tech softwares, such as Skype, Zoom, FaceTime, and WeChat. And if you can use that kind of software or computer accessory to keep in contact with other elderlies, other friends, it would cut down your sense of feeling isolated. And actually, it can help you to maintain a regular social circle connections. And while you're doing that, make sure you use the information in a reassuring way. Don't spread the negative news around. Think positive. Encourage people to look at the positive side. Saying, oh, now it seems that the number of cases actually has maintained a flat level or even going down. Those are good news. And be supportive and give more attention to people. If you know that your friend or your family members, your grandparents are having any kind of discomfort or a medical problem, make sure you connect with them on a regular basis to show that you are concerned, you want to offer them as much help as possible. And encourage healthy habits and good hygiene practice. One thing that has been emphasized a lot is whenever you go out, make sure you wear your mask. When you come back, make sure you wash your hands. Use those alcohol wipe whenever possible. And those are very important hygiene habit or practice you need to do these days. And once you know how to deal with your own stress, it's important for you to share your effective or successful skills with your friends and family, so that when they are under stress, they know what to do. So if you happen to have the following conditions, either you or your friend or your family member, then you may want to consider seeking help immediately. For example, you feel like your worry level has become uncontrollable and unmanageable. Or all day long, you keep thinking about all the bad things that are going to happen, and you cannot stop worrying. You are constantly pacing back and forth. You cannot focus. You have lost your appetite because of what is going on, or you have a severe sleeping problem, or you have difficulty in maintaining your daily chores, such as cleaning house, cooking, and that sort of things. You cannot do it, or you don't want to do it. Or you feel like you have increased your drinking or smoking to the point that you need to do that in order to numb yourself. So those are concrete signs to show that you may need to seek professional help as soon as possible. The following are several avenues that would offer interpreters for their services. There's the PS Psychiatric Emergency Services related with SF General Hospital. And there's the Community Behavioral Health Service Hotline and the Asian LifeNet Hotline and the San Francisco Suicide Prevention Hotline. Those are good places for you to seek immediate service and also with the language capabilities. And most important of all, and there is this online health talk service with AAMG. On it, you can find all sort of information that can help you if you have those conditions or concern that we just mentioned above. Okay, that's what I want to talk about today, and thank you very much.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like, and subscribe to our channel for more related content.